Hi everyone, today we're going to discuss fascia, which is a component that could be missing in your CCI treatment. And if you are an athlete or someone who got into an accident, you could suffer the neural symptoms from CCI. And this area of the neck and upper back region has many layers of myofascial connections. You know, in mainstream, often you will hear people say, okay, have you tried prolotherapy, which is an injection treatment, usually sugar dextrose into the affected area. The main goal is to trigger inflammation, mild inflammation, and encourage the body to naturally heal. But what happens often in the cervical instability case is that the underlying fascial structure also get disrupted. And because fascia is missing from the mainstream, really the PT, also mainstream dissection, is not often talked about. And why it doesn't work necessarily is that, yes, you can inject to the area. However, the fascial structure is very difficult to remodel, right? So the structure itself needs to change. Now, the sugar injection is not going to change the fascial structure, and it's not going to give you the lost tensional strength that you incurred, that you suffer from the particular injury or trauma. Other trainings such as posture training, because those are short term, because there's no such a thing, even in athletics, there's no such a thing, let me just change the form, you're going to get results. Otherwise, you know, you can just change the form and shoot like NBA players. That's not that easy, because the underlying fascial structure is also different. That's why, you know, you can copy the form all you want. You're not gonna shoot like an NBA player. Really have to train the fascial structure within the body to achieve that over time. Another probably most tried procedure would be manual massage. The Steichel method is something new that's really, I think it's going to be helpful to a certain extent. Also, there are Rolfing-based, John Barn, I think is another therapist that have used fascia as a main ingredient in the manual therapy technique. But I'm going to talk about really the structure of the fascia, why this is so important. So people who haven't, you know, seen this before, well, let me explain what this is, okay? So the top and the bottom, they are fascial layers. And then you have these structures within it, okay? You can see it's a 3D structure. And these are microscopic structures within the body. And fascia is mainly made of the water and collagen. So, you know, when you do dissection, because it's only 1 to 3 millimeters, especially the superficial fascia and the underlying fascia, it's very, very tiny, right? It's very easily dismissed. However, these structures play a significant role in your daily lives, and also affects the way that you feel, because this contains 10 times more sensory nerves than just muscle or any other tissue that you have in the body. So why this is important? Because as the fascia glide, so the top layer and lower layer glide, it creates these structures. So the vertical strings that you see here, these are fascial structures, and you know, this is simplified, of course. Then I have these structures where you see you have holes, right? And guess what? Let's say I have, imagine this is a nerve. The nerve has to go through the fascial structure. Now, if the fascia becomes disorganized, and for example, it doesn't have this room anymore, it just collapses like this, guess what happens to your nerve? Your nerve also gets entrapped. And this is why, for example, for people who have nerve impingement in the wrist, they actually do a procedure and they have to cut the retinaculum around the wrist to feel better, right? Your fascia in the cervical area, it really needs to be, number 1, reorganized. Number 2, the strength has to be built in. And how do we do this? We really have to be concerned with 3 major fascial lines, channels or matrix, however you want to call it. The large dorsofascial line, which goes from the bottom of the foot all the way up to the glutes and to the spine and all the way up to the neck and skull. This is a very powerful fascial line and fascial connection that you have to strengthen. That's why we do assessment. So whenever you have this type of condition, you want to make sure that this fascial connection can be enhanced. The second one is the shoulder elbow line, fascial line. This runs from the outside of the forearm up to the deltoid, passes onto the fascia of the trapezius muscle, and which connects to the neck and back of the head. This is also very, very important. And then you have the diagonal torso line, which runs spirally, okay, around the torso like this. And this is why, if you do, fascial dissection, you will see, especially in the pelvic region of the hip, there is fascial direction of how the fascia is aligning up to the movement of the body. You have rotation, right? If you do rotation, you're going to see that. And this is all very, very important. One aspect that majority of the people haven't considered is when you suffer an injury, does that injury occur in the muscle or in the fascia? Now, there is a study that was done by a German doctor, and they found out that surprisingly, majority of the injury suffered, they are not on the muscle itself, they are on the fascia. And that's roughly over 70 to 80% of it. And then fascial structure disruption could really trigger numerous symptoms. So if you have CCI, you could experience, a lot of neural symptoms, neural fog, brain fog, tinnitus, even swallowing issues, jaw problems, and just feeling you have a bubble head. All this could affect your day-to-day activity and day-to-day life. What is really important is you have to understand the disorganization of fascia. Disorganization means that you have a nicely spaced fascial structure to start with. Now a trauma or injury could, force this structure to collapse, all right? Collapse. Now it's disorganized, you can see that. And whatever nerves in between is trapped. And this will give you a lot of different sensation. It's not just the nerves, the arteries, veins, your lymphatic system channels, your glymphatic system channels. So the glymphatic system is really what takes out the neurological waste from your brain. This is very important. So imagine these channels being collapsed and pressured by the collapsed disorganized fascia. Fascia is actually 22 kilo worth of material in your body. So it's large and it's holistic. It covers from all the way from the head all the way to the toes, and it's within every fiber of your muscle. So when we do dissection, we open up the body, the muscle actually doesn't have its shape without fascia. And also the muscle material, how it feels like is without the fascia, it feels like bananas. It's really soft. But only with the existence of fascia does it have its shape. So when you flex your muscle, right, you see, oh, my triceps, my biceps looks good. That's really because also there's a fascial component to it. The fascia gives its shape. If you have lost this stability within the body, you have to really consider doing this type of work. And you have to recreate the strength and tension back into and organization back into your fascial system. So I talk about massage, prolotherapy. Some people even consider surgery, right? Also acupuncture. Acupuncture could help reduce some of the symptoms. However, the fascial structure itself, you have to really generate and create that strength on your own, because once it's disrupted, you really have to create that strength. That's what's unique about the HFT protocol for cervical instability. And we have to do different type of corrective exercises and mental exercises, mind to body exercises and movement to help you recreate that structure. Another aspect of the fascia is, the gliding ability. Now, a good fascial structure, as you're doing a movement, the top superficial fascia and the lower the deep fascia, they should be able to glide and slide without problems. However, in the people who have, for example, chronic pain, they couldn't glide anymore, or they glide very, very little. And that creates not only friction, but also problems. Because then the region that we see is very little, of course, when we do ultrasound study. However, it's going to create a global effect. And there are other areas of the body when this gliding couldn't occur properly, it also causes compensation patterns. So the people that, first they could have the cervical instability problem, and then now they feel their body holistically is disconnected when they try to do like strength training, for example. Another type of consideration also missing from the mainstream treatment is the people could tell you, oh, stem cells could help you regenerate some of the body damage, right? But there's another type of cells called the fibroblasts. Now, the fibroblast is a new science, because the fibroblast is a precursor to many holistic healing functions. And there's actually a company called Fibrobiologics. They actually is a $100 million capped company currently. Their goal is to really come up with this different type of fibroblast cells and to help people with different chronic pain conditions, of course, and because of the fascia, right? So we know that this is a sound science. There are many researchers are in this space now, and getting into this space is an emergent science. So the fibroblast to myofibroblast. The myofibroblast could be created through mechanical tension. So when we do our exercise properly, when we do our movement properly, we're also creating myofibroblasts. And this cell is very interesting, because this cell actually starts to gel everything together, and it actually makes the structure more stable, and is a precursor to many of the holistic healing functions of the body. And when we do our hyperarch fascia training work, we're really trying to help the body go into this natural state of getting stronger fascially, creating better fascial connections. So in the beginning, when you do these very simple exercises like the tall curls, you could have no connection whatsoever from the foot to the glutes. But over time, you're going to create that connection. And guess what that connection is? A little test from what I said before. The large dorsal fascial connection from the foot all the way up to the skull in the back on the posterior chain. So this is what's really important. Another aspect of training that you could be missing is breathing and also meditation. Why this is important? Because some people, when they have fascial related problems, let's say your fascia have a disorganization that could impinge on the vagus nerve. And that could cause, fight and flight response. That could cause different type of neurological symptoms. Now, when you are in the meditative state, you focus on the right now moment, you actually use right brain, right? You're trying to focus on the moment. You're not, overthinking, you're not worrying. So all this psychological aspect of this type of injury could also hinder your progress. So all this has to be addressed holistically. Of course, the diet matters. Of course, getting sunlight is equally important. So in this video, I just want to give you a brief overview of what could happen in a HFT protocol program and what are some of the missing components that you were not being shown. And I want you to start doing the basic 3 HFT and start to feel the difference in your body. And of course, if you need more results, you can always book assessment so we can understand the unique situation that you have and then help you. Thank you.